Well, thank you very much, Mr. Chairman. Thank you for calling this hearing and all of your work on this really serious public health crisis. I'm very pleased today to welcome Dr. Sharisa Fatinas, who is the Deputy Medical Director of Washington State Healthcare Authority. Thank you so much for traveling out here from the better Washington to this one. Great to have you all here. I'm looking forward to hearing your testimony as well as from our other state witnesses about how they are using federal resources to make a real difference in the lives of patients and families who struggle with addiction, and what additional actions are needed to stem this epidemic. Since 1999, almost 400,000 people have died from an overdose involving opioids, from prescription painkillers to illicit opioids such as heroin to synthetic opioids such as fentanyl. Approximately 130 people in this country die every day from an opioid overdose. And the White House's own Council of Economic Advisors estimated the economic cost to our country of the opioid crisis is over $500 billion each year. This doesn't begin to capture, of course, the emotional devastation caused by the opioid crisis, from health providers who are treating babies born addicted to opioids, to more kids who are placed in our foster care, to parents who have lost children to an overdose, and some even now raising their children's children as a result, to veterans in chronic pain who are struggling with addiction, and the list goes on. So I'm concerned the Trump administration has been shockingly silent when it comes to addressing this crisis of addiction here at home. Earlier this month, the administration released its first ever national drug control strategy. It contained nothing new, identified no funding needs, is 20 pages long, and easily summarized in 2 words: not enough. But despite the administration's inaction, Congress has taken steps to address the epidemic. With bipartisan support, the Congress passed 2 major pieces of legislation through the HELP Committee to deal with the epidemic. Our chairman, Senator Lamar Alexander, is here. Thank you for your work on this. And this subcommittee, Senator Blunt, has worked hard and provided an increase of $2.6 billion in new resources to combat opioid abuse, which includes $1.5 billion in block grants to states through the State Opioid Response Program. But we know that this barely addresses the scale of the problem. Medicaid is by far the nation's largest payer for behavioral health services, including services for people with substance use disorders. Together, the Affordable Care Act and Medicaid expansion have expanded access to treatment for millions of families, providing a critical lifeline for people with substance use disorders. The Trump administration does claim to be fighting the epidemic, but the reality is it's done everything in its power to undermine access to treatment, which is so important, including taking Medicaid coverage away from people who can't meet bureaucratic hurdles to prove they've reached a minimum number of working hours, causing tens of thousands of people to lose their vital coverage, and supporting health care repeal efforts that would cause millions of people to lose health coverage and make coverage worse or less affordable for millions more with pre-existing conditions. I hope to hear today from some of our witnesses about how they're using Medicaid expansion and other federal resources to address the epidemic. And I also hope we'll hear from our witnesses about how to address areas where there are treatment gaps, such as in rural areas and among Native American populations. There's a lot more that needs to be done, so I hope as we listen to our witnesses today, we'll continue listening to each other and looking for additional opportunities to address this crisis in a bipartisan way. Thank you, Mr. Chairman.